Well, the COVID outbreak has taken a toll on the health of healthcare service providers as occupancies drop, elective surgeries were cancelled and costs rose. While the first quarter was a washout, the second quarter has seen some improvements. The first half of the year is closed on a shaky wicket with both Apollo Hospitals and Max Healthcare ending in the red. So when do India's hospital chains hope to be back in the black? What is the outlook for costs and expansion? And more importantly, what changes can we expect in the business model? Joining me today are India's three large listed hospital groups: Sunita Reddy, the Managing Director of Apollo Hospitals; Abhay Soy, the Chairman and Managing Director of Max Healthcare; and also with us, Dr. Bishnu Panigari, the Group Head of Medical Service Operations at Fortis Healthcare. Sunita, Abhay and Dr. Bishnu, many thanks for joining us. Sunita, let me start by asking you, given where we find ourselves with the pandemic today, the possibility of a second wave and more, pressure on the healthcare infrastructure, what's the outlook? Do you believe that the worst, at least in large parts of the country, is behind us?
Yes, I truly believe that the worst is over. I mean, Delhi is proving to be an outlier, but if you look at what's happening in the other parts of the state, there has been a certain amount of immunity has come in, with about 30% of the population getting COVID, and some of them mild forms of COVID, but definitely there is some immunity that has been built up. It has followed peaks and troughs with the cities, the urban centers first getting COVID and then going back into the districts and sometimes coming back into the urban centers. But I think the trigger for this, as you know, in India, our festivals are big occasions. So I believe that, once with the lift of the lockdown and really people wanting to get back into shopping and meeting each other, it has come back in Delhi.
Yeah.
I do believe the numbers will be far less than what we saw earlier in the first quarter and in the second quarter.
Well, we have been declining now in terms of active cases nationwide for the last 30 plus days. As you point out, Delhi at this point in time is the outlier. But Sunita, what does the business outlook then look like as far as hospital service providers like yourselves are concerned? If I were to take a look at your Q2 picture, revenue coming in at about 2,761 crores, EBITDA at 300 crores, margins both for you and Max around that 11 to 13% range, and PAT at about 59 crores. What's the business environment looking like now?
Much better. So if you were to look at the business environment, you would see that we've grown 27% over last quarter. And I think we're gaining momentum, because even if you look at occupancy, we've moved from 56% to 65% occupancy. We're now trending at 70% group wide. And clearly, occupancy is an indicator of how well the hospitals are doing. What is slow to come back is the OP. And I believe that there's a little bit of fear of people, that they really don't want to come in for health checkups, etc. But this will change, because we're seeing that those with COVID have to undergo these checkups, because it leaves you with damaged heart, damaged lungs. So we've started these recover clinics, which are gaining traction, and our OPs are starting to get filled up. But most importantly, the surgical volumes have moved up by 18% and trending towards 25%.
Okay.
And that's a good indicator that that patients are coming back, and there is some amount of pent-up demand. I think the only thing that will really slow down growth this year is international travel. So for companies that were heavily dependent on international patients, and our dependence was about 10%.
Yeah.
I think this international travel will only start trickling in only in the fourth quarter.
Yes, that clearly is an area where it's unlikely to see a pickup anytime soon, given the fact that the restrictions continue on international travel. But Abhay, let me ask you, Delhi at this point in time recording a surge in cases. We're seeing a spike of over 8,000 cases being reported overnight. What does that now mean in terms of infrastructure? I believe ICU capacity is full up. So first, let me start by talking to you about Delhi, and then I'll ask you about what the outlook is going forward.
Shereen, we've kind of started to learn to live with COVID in Delhi. It's been quite unabated since the first wave. We are in the midst of a third wave. And this third wave, again, is bucking the trend with respect to the rest of the country, because this third wave is actually significantly higher than the first two. But having said that, I would like to correct you with respect to the performance of the company. We have had an increase in revenue by 53% over last quarter, whilst it still remains 12 to 13% below the same quarter last year. Having said that, our EBITDA is only 8.5% lower than same time last year and significantly higher than the previous quarter. The EBITDA margins we are operating at are now 16.7%, which again is higher than the 15.2% we were operating at in the same quarter last year. So that 11 point something is perhaps not the correct number.
Oh, that was the number for Apollo. I have a number of 13% in terms of margins for you.
Well, it's 16.7%. So I think it's on the BSE site as well
16.7.
Our website. And with regards to infrastructure, I think there is a massive paucity of infrastructure, at least in the private sector in Delhi. ICU beds, be it COVID or non-COVID, both are completely occupied, and so are the beds otherwise. Non-COVID capacity, we are operating at about 85%. The COVID capacity, we are operating at about 76%. And as we speak, our hospitals are operating at a capacity utilization of 81%. This is going to be challenging right now, Diwali and after.
Yes, it certainly will be challenging given where we find ourselves specifically in Delhi. But Abhay, since you talked about your margins coming in at about 16.7%, and a lot of businesses across different sectors are rejigging the economics and the business model, how much more will you be able to eke out in terms of cost savings given the sort of challenging times that we live in? What is the expectation in terms of the ARPU per bed?
So ARPOB per bed, when we look at ARPOB per bed, it is a little lower. We were at about 50,000 in the same quarter last year. We are operating at about 46,500 at present. But then it gets overcompensated by the occupancy. We are presently operating at an occupancy of about 80-81%, whereas all of the pre-COVID times we were operating at an occupancy of 70 to 73%. Having said that, like I began by saying, we've all kind of learned to live in this new reality, which is of COVID. You're going to have increase in COVID-related costs, hygiene costs, and so on and so forth, staff welfare costs. But on the other hand, digital is something which was on the peripheries. We've all started embracing it to the core of our businesses. Travel has been reduced, and so therefore a lot of costs have been worked on. A lot of the cost actions we have taken in the previous year, which are bearing fruit now, and we continue to do so in the current year as well.
Dr. Bishnu, let me ask you to give us an update on where things currently stand as far as Fortis are concerned, and whether you truly believe, like Sunita and Abhay, that the worst is behind for service providers like yourselves.
I agree with Sunita what she was mentioning about Delhi being an outlier. And I think so Delhi has seen a surge, and I'll keep my fingers crossed about a third wave coming up in Delhi, if I can put it this, because as of today, all our ICU beds across the Fortis network and Delhi NCR, all the hospitals that we have are full. So that gives us an indication that the COVID cases are coming up. In fact, I've been getting calls that do you have a bed here, do you have a bed there? So it's a concern, I can put it. But we are prepared, and over the next 10-15 days will be the challenge that what happens. So only time will tell. But on the other thing that I mentioned, that in other hospitals, we are seeing a resurgence in the growth. And, the OPD numbers have increased. There are certain, whether it is Mohali, whether it is Anandpur, whether it is in the Mumbai region, even in the Bangalore regions, we are seeing an upside as far as OPD footfalls are concerned. The surgical cases, we are nearly now around 75 to 80% of the surgery volumes that was we were having last year around this time. So that's a good thing to have. Some of the high-end surgeries, we are still lagging behind as far as cardiac and neuro is concerned, because the concerns of coming in. That needs to pick up. But in general, I think so we are on the right track for recovery. And your last months, if you look at your GST collections, was the highest. So that gives an indication that things are moving, and if the economy also moves, we'll also see the similar thing in the healthcare sector also. But Delhi is a concern. If I can put Delhi
Okay.
NCR.
You're absolutely right. Delhi NCR is a concern at this point in time. But let me get the three of you to talk about the regulatory environment. Sunita, let me start by asking you, there was that order that came in from the Delhi government to reserve 80% of the ICU beds for COVID patients in private hospitals, which was stayed by the Delhi High Court on the 22nd of September. But now relief has been granted on that. This is only one aspect dealing with one state government, but across India there are many restrictions that have been imposed by different state governments, whether it's price caps or otherwise. What does the regulatory environment currently look like, and by when do you expect relaxations on this front?
If you look at India, health is a state subject, but we also have to talk with the center when they talk about price capping, etc. Having said that, I think most of the state governments have been sensitive to the cost of treatment with regard to COVID. There again have been some exceptions where Delhi, for example, and Abhay knows that much better, where you had to go to court to do it. In Calcutta also, we found a certain amount of price capping. But, on a contribution margin level, I don't think it's severely impacted us. And we do have to remember that this country, the whole country is going through this crisis. So we are not here to make profit on COVID. I think we should make it from others. But otherwise, I think once COVID is over, the government will appreciate the huge demand-supply gap that there is in India and encourage private healthcare investments and those who have invested in healthcare.
Well, to encourage more private sector investment, it has to deliver the fact that there is a robust business model. So, Abhay, let me ask you about that. Now, given where things currently are, what is the expansion plan? Are we likely to see a significant delay or a pause till we see some degree of certainty return?
Shereen, I don't think there is uncertainty in business, so to say. I think, like Vishnu mentioned, surgeries, non-COVID surgeries, etc., back to 75-80% of earlier levels. With COVID over there, if we're operating with the occupancy of 80-81%, clearly there are no beds. And this is, mind you, nighttime occupancy. Our daytime occupancy goes up to 110%. That means there are no beds available. In this current crisis of COVID, whilst this continues, of course, you have to have a little bit of a pause as far as expansion is concerned. But the minute this kind of abates a little bit, we intend to expand both our Delhi and our Mumbai facilities, by 900 and 650 beds each. I think the challenge continues in being able to get further pieces of land in metros and non-metros, etc. But other than that, clearly the business model, there's such a huge demand and supply gap that you're seeing even at present. There is absolutely, clear rationale in terms of expansion.
A clear rationale in terms of expansion. Do you foresee more consolidation? We've just seen a pretty substantial deal go through with Manipal playing consolidator. Do you believe that this sector is going to see much more consolidation, Abhay?
Absolutely. I see a lot more consolidation coming up in the sector, and I actually see a lot more in the mid-sized market, the nursing homes and so on and so forth as well. The larger players, the listed players, they have access to, to capital markets. We have access to banks and so on and so forth. But, and if you see the first quarter performance across the board, it's been, a lot of red out there. So, and a lot of smaller nursing home, mid-sized players, etc., have gone out of business during this course. And I think, they will be, it is going to be characterized by consolidation going forward. No doubt on that front.
No doubt on that. Dr. Vishnu, let me ask you that, what is this going to mean then from a future opportunity point of view? The government has put in place guidelines for medical profession to go digital. We are starting to see a lot of startups in that space. For large companies like yourself, what will the future when it comes to these new opportunities look like?
Shereen, I can put it this way. Now we are having this interview digitally. So that is the thing that's happening across the healthcare sector. Doctors have now started taking up the platform very well. We are having e-consults. In fact, speaking on COVID, lot of our COVID consults are happening. The patients who are can be kept at home on an e-consult, a doctor consults them. There's a 0-day consult, 3 days consult, 10 days consult. Everything is followed up. So you can preempt some patient from going from bad to worse and quickly get them to the hospital, to whichever nearest hospital is there. So these things are happening, and this is the way forward that is there. And on the other thing I would like to just put across is that across the healthcare chain, irrespective, the private sector across India has done a human job as far as reaching out for the COVID patients, and they stepped forward. So I think so. I'll take this platform of yours to appeal to the government that please look at the private sector as a partner to take forward healthcare, because this pandemic has exposed all the shortcomings that exist in the healthcare sector, and the private sector has stepped forward.
Yes.
Without, as Sunita rightly mentioned, about profiteering. Obviously, we have to be afloat financially, otherwise we will not sustain ourselves. So, and the other thing that is there is that it's a huge employment generator. So please look at it as from that point of view. And the last part I'll say is that more than 50% of the people employed in the health sector are females. So wherever there's female employment, that society goes up, the social index goes up.
Yes, and this is an opportunity for India, and we've often discussed this, Sunita. Every year at the budget time, there is a long list of demands that the healthcare sector puts forward. In fact, today, as part of the credit guarantee scheme, the scope of that scheme has been enhanced, and it will now also be accessible to the healthcare services sector. Sunita, very quickly, what is it that the ask is now from the government in light of the experience of the last few months dealing with COVID?
I think, we're going back to what we've always asked them. One is the fact that, we have a negative GST, not even zero rated, but negative, which means that we have no set off against our costs. So our input costs are really high. For example, if we really wanted to do an asset-light model and expand the number of hospitals that we have, the leakage that comes because of GST is about 18%. So it makes this whole concept of REITs highly unviable in a sector that needs something like REITs. So this is just one example. But I think just going forward, customs duties that are still being imposed on imported products. India has re-engineered itself so that, we can now buy PPEs and everything that you need for COVID here. But still, some quality products, equipment, all that has to be imported. And I think it's unfair that we have to pay these high levels of customs duties. And of course, we also pay taxes. So don't forget, we pay GST, we pay taxes. And there is a lot of leakage that happens because of that. I believe that if they want to incentivize healthcare, they can also think of 35AD, which is a 150% weighted deduction for new investments in healthcare, and that should give the impetus to grow. So these are some of the ideas.
The tax demand. And the tax demand you've been making for a while, Sunita, but hopefully, I don't know whether the government is in the capacity to do anything, at least on GST at this point in time, but that'll be up to the GST Council. But Abhay, since Sunita brought up the issue of the asset-light model, what do you believe is the road ahead when it comes to differentiating the kind of business models that we've gotten accustomed to, given the changes that we've seen in the market and given the changes that the government is also trying to push?
I think clearly asset-light model is one way to go about it. The second would be PPPs. I think public-private partnerships. Clearly, there is a requirement to create a lot more healthcare infrastructure in various states, in various countries across the world. Most governments would be hard-bent to be able to fund this. So there's a requirement for both domestic private capital as well as global capital for this. There are some pushbacks in being able to do something like that because land availability isn't there. Every city, every state has its own bylaws in terms of for construction and so on. So there are quite a few impediments. The FDA Act, which is from they've been there since 1847. I think there are a lot of impediments that we work with. We're a highly regulated sector. We have to renew close to 85 licenses per hospital per year. I think, a lot of this stuff needs to be ironed out to make it accessible, for capital to come in and be able to create these assets in India. I think GST again is a case in point, whereas I can understand most, input, items already have GST components to it, but manpower is one of them, for example, where they can do away with GST. So most of our inputs have GST in it, but output doesn't, that is frankly, if you ask me, look, there is scalability, there's opportunity. The private sector in India can be an answer not only to India's healthcare problems, but world's healthcare problems, so to say. I think what we require is stability of policy. What we require is, the right focus on regulation, but in the right areas. But I think, it's just sweeping regulations across the sector is something which has hampered the sector. There's been the promise of India, but as far as healthcare is concerned, but it's beginning to look more and more like a mirage. I mean, if we continue down this road. So really, I think it's for us to sit with the government to iron it out. More than ever, this is a great opportunity going forward.
This is a great opportunity so that the ease of doing business is not a mirage, it's a reality. Dr. Bishnu, in exactly 1 minute, sir, since Abhay was talking about public-private partnership, just today we've seen the ICMR sort of ink a strategic partnership with Serum Institute when it comes to the COVID-19 vaccine. Now, from a healthcare service provider's perspective, what do you believe a public-private partnership model could look like?
In fact, thanks for asking the question. Odisha model that was implemented for this COVID, I think so, is the standout example. The chief minister, he got the private sector into play, and they set up roughly around 5,000 beds across the state, in the state capital and then the district hospitals at various places to quickly scale up so that patients who have COVID do not get hit. So this is a standing example. I think so, as Abhay rightly mentioned, public-private partnership is the need of the hour. Abhay has Max hospitals in Bhatinda and Mohali have that. There may be some way to tweak it and see that both sides benefit. And I think that's the best way to scale up, because these pandemics can hit us anytime. I hope we don't have another one. But we need to have the infrastructure ready to scale up. And I think so the private sector has the ability to scale up at the earliest, quickest. And this pandemic has really shown it that way.
Well, those are important lessons and insights that you've given us, Sunita Reddy, Abhay Soy and Dr. Bishnu. Many thanks for joining us here on the CNBC-TV18 special. And we do hope that policymakers are listening in to what they've heard on this panel. And we will bring you back, hopefully, if there is some forward movement on some of the suggestions that you've thrown our way. We'll take a quick break. There's a lot more coming up. Don't go anywhere. We're back in a moment.